Hello, everybody. I want to talk about a topic that's becoming near and dear to my heart, which is medical gaslighting. And I'm actually here currently in a room right now and ran into a surgery nurse, and we started talking about medical gaslighting. And we started talking about this interesting situation, this thing called Yuppie Flu back in 1984. And so what this illness, Yuppie Flu, was a lot of young women, middle-aged women getting sick in Incline Village. So if you want to look up Incline Village to learn about this, but the concept is that a lot of young, middle-aged women start getting sick, developing chronic fatigue, developing fibromyalgia, fevers, chills, aches, and the diagnosis, eventually the CDC came out to investigate the site. And what the CDC said was they had Yuppie Flu. It was a psychological illness of women, of middle-aged women. And so the point is that medical gaslighting is something that happens all the time. I want to keep on talking about this over several videos. The gist being is that this happens all the time. You know, this disease eventually became known as chronic fatigue syndrome, or myalgic encephalomyelitis, which is kind of interesting. But the point is that this concept of medical gaslighting is pretty common, happens all the time. Towards the end of this series, we're going to find what the actual cause of Yuppie Flu was. But the gist is that our system routinely takes things they can't explain, particularly in women around menopause. If they have fatigue, fibro, headaches, pain, joint thing, we define it as being a psychological issue. Again, so how do we define medical gaslighting? I guess maybe that's the question to ask. And what I would say is medical gaslighting is taking something we can't explain, which in medicine we call idiopathic, and relegating it to psychiatric, mental health issue, stress, things that we can't explain, instead of looking deeper and trying to find out what was behind Yuppie Flu. Okay, I never had actually heard of Yuppie Flu until this morning, actually. So that's what we're going to talk about with the next couple of things. So if this is interesting to you, like, subscribe, follow. If you're interested in what Yuppie Flu might be, if you have any guesses, put them below. Don't go ahead. But we're going to talk about that over the next several episodes. And the big thing is medical gaslighting. If you have an experience of medical gaslighting, I'd love to know about it. Maybe take a deep dive and maybe we can kind of figure out what was going on. Because I love this topic, mainly because this has been going on for a long time. It's been going on for actually hundreds of years in our healthcare system, particularly in the West. And now we're just getting to the point where we actually understand what medical gaslighting is. And if you've been medical gaslit, been told it's all in your head, there's nothing wrong with you, you can't be helped, then you need to probably work with a functional medicine person, someone who can actually help get to the root cause of what's going on. So anyway, I'm excited to start this series. We'll talk more about this next video. Take care. Talk to you soon.